Hello, welcome to News Decoder's webinar on COVID-19, keeping one's mental balance during the pandemic and after. My name is Nelson Graves, and I'm speaking to you from southern France, and I'm joined on camera by our expert therapist, Pat Spencer, and also we have 4 students from partner schools of News Decoder, as well as Akila Wise, who is joining us from Georgia. I'd like to go around and ask our panelists to introduce themselves. Pat, would you like to just say a few words about you, who you are?
Sure. My name is Pat Spencer. I am a licensed clinical social worker in New Jersey, and I have a private practice where I'm a private practice therapist in Highland Park, New Jersey. So right smack dab in the middle of the state, just across the river from Rutgers University.
Thank you, Pat. Julia, you're also in New Jersey. Why don't you kick off the students' introductions?
All right, sure. Hi, I'm Julia Colenda. I'm in Kearney, New Jersey at the moment. I go to Westover School in Middlebury, Connecticut. I'm a freshman there, and I take part in the News Decoder Club at my school.
Thank you, Julia. Ava, you want to say who you are?
Sure. Hi, my name's Ava. I'm coming from upstate New York, about 2 hours north from the city. About me, I'm coming from SYA Spain. I was there for about 6.5 months. Now I'm back here. In the fall, I'll go back to school at Andover, which is a boarding school similar to Westover. I do News Decoder at my school. I'm also involved in English tutoring and the crew team.
Thank you, Ava. Monica, over to you.
Hi, my name is Monica, and I'm currently in Beijing because of the COVID-19. I'm a junior in Westover, a girl boarding school in Connecticut, and my hobbies are like swimming and reading and yeah.
Monica, what time is it in Beijing right now?
It's 12 a.m.
My goodness, you get extra points for appearing at 12 a.m. Thank you very much. Casey, you wanted to say just a couple words about yourself?
Sure. I'm Casey Ingerson. I go to Westover. I'm a senior, so 12th grade. And I am in Connecticut in the United States, and I like to do theater and singing.
Nice.
Thank you very much. And let's see, I think the last one would be Akila. Would you like to say a few words about yourself?
Sure. Thank you, Nelson. Hi, my name is Akila Wise. I'm a public health researcher and journalist based here in Atlanta, Georgia. I've written for News Decoder. I'm a former fellow with the Global Journalism Fellowship at the University of Toronto. And I'm covering right now the intersection of COVID-19 and mental health.
Terrific. Thanks very much, Akila. Right. Well, this is going to be primarily a conversation, lots of Q&A, but first I'd just like to say that COVID-19 has been traumatic in many ways, great and small. Writ large, billions of people have been confined to home and many millions have lost their jobs. At the individual level, students have seen their lives stopped in their tracks. Uncertainty pervades, stirring anxieties and myriad questions. If teenagers define themselves by interacting with others, then COVID-19 leaves many young people asking the very difficult question, who am I? Today, we're interested in the mental challenges that COVID-19 is posing, but we're also interested in the lessons we can all draw from the pandemic, because it will end someday, even if we do not know when, and we'll need to keep our mental balance then too. So with that, I'd like to turn it over immediately to Pat to say a few high-level remarks before we get into Q&A. Pat?
All right, great. Thank you so much. So first of all, I just love that we have people from all over the world, from Beijing to Connecticut to Atlanta. This is just terribly exciting for me. But I do want to talk just a little bit about what is mental health, because when we talk about mental balance and keeping our mental balance, and also the possible psychological and emotional impacts of COVID-19 on the long run, first we need to have some understanding and maybe some common language about mental health. So mental health essentially captures 4 areas of our life. Our emotional, so that's our feelings, our psychological, which is kind of the meaning that we make of those feelings, our social, so how we're connected with others, and also our spiritual, So whether that spiritual happens to be an actual religious belief and actual religious canon, or a spiritual belief of where do I fit in the world? What is my purpose? What is my meaning? All of these 4 areas are greatly impacted just in our day-to-day life with everything. Whether it is going to school and having friends and connecting with others and feeling like we belong, we can say that our mental health is probably pretty good at that moment. Maybe we're at school, maybe we're not as connected, maybe we're having kind of a bad day. Then we might say that our mental health might be slipping just a teeny tiny bit. And so every day our mental health can fluctuate. And even throughout the day, our mental health can fluctuate. But overall, we do have a larger mental health functioning. If you will, it can be like climate as opposed to weather. And right now with the COVID-19, this has been thrown totally off kilter. Because as many of you have experienced, and I think probably actually just about everybody in the world has experienced, is that what was familiar to us, what was common to us, what was predictable to us, has been completely just thrown up in the air. And now the pieces are landing and falling where they may. And many of us are still safe. We are, at least I hope we're safe. We are at home, which hopefully home is a safe environment. We are hopefully having food on our table. Hopefully some of our friends and family, or most of our friends and families, are well. But we still have all this unpredictability. Whereas many, especially many of the students, one day we're at school, and then quite literally the next day, if not the few days later, we're at home. And at home, all of a sudden having to learn how to be at school, how to do things. So when we talk about mental health balance, it's about recognizing that when things are unpredictable, if we can somehow keep our heads about us, we can get through it. And that if all we're looking for is kind of, I want to go back to normal, we might have to redefine what normal is and look at what is it that we want? What is it that we want to get out of it? So one of the big things we want to look at is how do we cope with these uncertain times? And a model I love greatly, I talk about it an awful lot with my clients, with my friends, heck, I personally use it. I call it the 4 C's of stress hardiness. And when we can look at these 4 C's, we can get through some challenging times. And those 4 C's would be control, challenge, commitment, and connection. So when we look at the first C, control is looking at what do we actually have control over. I do not have control over if the government is going to keep things open or shut. I do not have control over if there's going to be spinach or toilet paper at the grocery store when I go. But what I do have control over is my attitude. I do have control over my perception. I do have control over interpreting my thoughts and recognizing my thoughts. The next C is challenge. So instead of looking at an issue as a problem, I prefer to look at it as a challenge. Because although it's just the change of one word, challenge versus problem, it actually conveys a lot of meaning in that. When I say problem to somebody, a lot of times they think that it is insurmountable, that it is going to be almost impossible to get up and around and over. But when I talk about a challenge, people can look at this will be hard, because it is very important to acknowledge that this is a hard time. But that with the right tools, with the right supports, with the right attempts, we can work through it, we can get over it, we can get around it. The third C is commitment, which is looking at what's actually important to us. And I think all of us have had our commitments really highlighted for us in the past, 4 or 5 months at this point that this has been going on around the world. Previously, some people were committed to, for high school seniors in the United States, senior prom is a big thing. So they had this commitment of, I'm going to go out with my friends. I want to connect with my friends. I want to dress up. I want to, go party. I want to do all these fun things. I want to have this rite of passage. And that was what they were committed to. And then when COVID-19 hit and social isolation, or actually as I would prefer it called, is physical isolation, is all of a sudden that commitment has changed. We've now lost senior prom. We've lost graduation, at least the ceremonies of those. But what is it that they represent to us? And let's look at what that commitment actually is. So for example, prom, a lot of times it's about, I want to spend time with my friends. I want to do something special. I want to feel like a princess for a night, or a prince, or whatever royalty you want. But how do we now redefine that? How do we find place for that? For those who were employed, their commitment previously a lot of times was defined by their job. I, for example, am a social worker. So my commitment is to social work. But when I was doing private practice, I was committed to doing it in person and meeting people where they were at, literally where they were at. Well, now my commitment had to change. How can I still be a social worker, but change the way that I do it? And then the fourth C, quite honestly, I think this one's probably the most important one, and I'll probably actually say that about all the C's. But the fourth C is connection, because connection with others is vital. And I think that's what a lot of people are missing in COVID-19, or because of COVID-19, because of the physical distancing. We are missing the connection with others. We are missing, if you're at work, you're missing being able to go to work and see your colleagues, you know, walking down the hall. Hey, how you doing? What's going on? Catch up with the kids and the grandkids. But for those of you in school, I'm going to guess that many of you are missing the connection of school, missing the connection of seeing your peers, missing the connection of going to class and that predictability of sitting down next to that same somebody all the time, missing the connection with your teachers, because although Zoom is good, there's nothing quite like in-person connection to really get us feeling really good. So if I'm looking at mental health balance with somebody, I'm really trying to build on those 4 C's. And oftentimes one of those C's is slightly out of balance when someone's not feeling so wonderful. So I want to try to help them figure out, where can we build up that. And at that same time, when I'm looking at those 4 C's, I'm also looking at those 4 aspects of mental health: the emotional, psychological, social, and spiritual. And how can I build those up within the 4 C's? Hopefully that makes some level of sense. It gives a very broad overview. Some of the challenges that we're facing right now in mental health because of COVID-19 and because of physical isolation is across the board. We are seeing increases of anxiety and depression. There's been, because COVID-19 is so new, we don't necessarily have all of the research in to support all of this. But what research has been done, starting in China and moving through Iran and Italy and now the United States, is that there is an increase of anxiety and increase of depression. And a lot of times that increase of anxiety and depression is due to the uncertainty. It's due to the rug being pulled out from under us, where all of a sudden everything is new, everything is different. And also some uncertainty of leadership not always giving us correct answers. And also maybe even just different days, they learn different things. So now everything is new. And that does lead to some increased anxiety. However, if we can go back to those 4 C's, we can certainly help decrease that anxiety and increase the people's feelings of competence and increase their feelings of safety, because anxiety really is about safety.
Terrific. Thanks very much, Pat. That's a great way to get the ball going here. Before we get the conversation going and questions, a couple things. First, we want this to be a conversation, so I invite they're called attendees, those are those who are observing off camera, to use the Q&A function, which is represented by an icon at the bottom of your Zoom screen, to ask questions at any time. And you can, in fact, you can vote you can vote for questions that you think are particularly pertinent and interesting. So feel free to ask those questions. Our panelists on camera will have the first crack at questioning, but anyone else, please feel free to use that function to ask a question. We'll be monitoring. Before we move into questions, I wanted to just launch a little poll here. I thought that might be interesting. You should see on your screen now, I hope, a poll. It says, have you changed your educational or job plans as a result of the coronavirus? We'll just give a few seconds. We've got 8, 9, 10, 11, 12, 13, 14, 15 out of 24. Let's see, we're almost at 100%. Few holdouts. Anyways, certainly we have a critical mass, 22 out of 24. Have you changed your educational job plans as a result of the coronavirus? 78% have said yes, there have been some changes, and 5% no. Interesting. A lot of change feeding that anxiety, I suspect. Just showing the results, you should be able to see them. Can you guys see it?
Yes.
Good. Okay. With that, then let's turn to our panel, and no real order here. I will ask Akilah. Maybe you would like to go first. Do you have any questions of Pat or any comments on what she said so far about the 4 C's? Anything else?
Well, not right now. I think that I'm hearing some echo.
No, you're okay.
Okay. No, I think what Pat had to say was very important. I'm more so interested in hearing from, especially our student panelists, on what are some of the unique challenges that they're encountering. I think for many of us adults, we may have some experience with some of the feelings of anxiety and depression just through life itself. But, you know, my concern is with those who are young and may not have as much of that life experience to be dealing with something as serious as this pandemic. So
yeah, good point. I mean, the students are probably going through a particularly challenging period. Monica, you're up the latest there. How are things in Beijing? How are you feeling about being so far away from your school and your friends?
Well, like Beijing, the peak already like passed. Because it started the earliest, so it started at like January, like the end of January. But like for now, I think like it's basically controlled. Every time, for example, every time we go out to the public, we have to wear masks, and then we have to bring like hand sanitizers. And then when we enter like different shops, we need to like register our phone number and our ID. And then we can go in.
So they're keeping close track of you then?
Yeah, it's like very hard. And then they have to like measure your temperature every time. And if you don't wear a mask, you have to be like sent home.
So yeah. They're keeping close track of you. How is that different from what you experience when you're in the US?
So for spring break, I stayed in New York, which is like where it like exploded in US, I think. So I was really scared because back then it wasn't that serious, and then I didn't see anyone like who wear like masks and stuff. So even when I'm in like the mall, I hear people like joking around the coronavirus and saying that it's just like a flu and it's not serious. But like the reality is crucial. It's hard, and it's like really hard for like everyone. So I think it's really different. I don't really know what's going on in America right now, but like back then, it wasn't that safe for me. But I think now the government's trying to control it for like self-quarantine, and I think that's like helping a lot. And they're trying to like improve the medical resources to help like more people who got infected. And they're trying to like prevent people from catching coronavirus. But like in China, for now, like the peak has already passed. So like I'm allowed to go out to the public as long as I have all my equipment. For example, like each neighborhood requires you to have like this going out pass. So like you need to like register every time you go out your neighborhood or your apartment. And then you have to like wear like a mask and then bring hand sanitizers. Like everyone in the public has like their mask and their goggles on.
A very disciplined approach to managing the pandemic. Ava, you were in Spain when things got hot. What about your experience? And do you have questions of Pat?
I mean, to speak to my experience in Spain, I left more than a month ago, so I can't really say, you know, what's going on right now.
No, I mean your own personal experience more.
Yeah. So my personal experience, when I left on March 13th, and I flew through London, and it was kind of really shocking to me flying through London and even arriving in the US. Very few people were wearing masks. You know, going through customs, nobody asked where I was coming from, and I was coming from a high-risk country, you know. So that was a little shocking to me, and it was obvious I was. You know, I have a Spanish visa in my passport. It's not, you know. So that was a little jarring, I would say. Now I think it's a lot better. I mean, I'm really lucky to have Governor Cuomo. He's doing, I think, a great job curbing the coronavirus kind of. Well, I mean, it got out of control in New York, but I think they're really doing a good job now, I would say. And yeah, so one question I actually had for Pat, and also maybe Akila can speak to this, but I'm really interested in New York. We can see kind of this disparity between people who have been infected. It's really like infections by income level are incredible, especially for instance in the Bronx. It's one of the highest concentrations of infections, and it's very low income compared to the, you know, the Upper East Side. They're doing relatively well. And so I was wondering, what are the resources in place specifically for low income people who may not have the, you know, who are having a harder time than others, you know, and how are we going to keep those resources in place after coronavirus, you know, in terms of mental health or, you know, actual like physical health?
That's a really wonderful question. And ironically, I was just on a webinar right before talking to you guys about social disparities in mental health, not necessarily due to COVID, because this was planned way before COVID, but it certainly came up, of how do we provide treatment and services and access to everything to everybody. You know, whether you happen to live in the projects in the Bronx or you live in the mansions of Westchester. You know, everybody deserves the same level of access to care and the same safety. So your question has multiple layers to it. You know, number one, how do we provide access to treatment? Well, thankfully, New York does have very robust medical system and actually has a pretty robust public medical system as well. There's also federal laws in place that state that a person cannot be turned away from a hospital due to inability to pay. So if a patient shows up at any hospital, there's the EMTALA law, which I forget what EMTALA stands for. It's like Emergency Medical Transportation something Act. And so it states that no matter who shows up at a hospital's doors, they can receive services. Now, I would be naive to say that somebody without insurance will receive all of the same services as somebody with insurance. I actually used to work in an ER, and I was one of the people who had to call and get pre-authorization for services. But I can tell you for life-threatening care, everybody can access that. There are certain other questions, like undocumented immigrants might be a bit more hesitant to go to the emergency rooms for fear of ICE getting notified, our immigration services. I can also tell you that in New York, the hospitals do not notify ICE, but people are terrified of that. And rightfully so. We see horrible things that happen in ICE detention centers. Also, people are afraid to show up in the ERs, especially or to get any medical care, if you are quite literally living paycheck to paycheck. If missing one day of work is going to impact your ability to pay rent, the chances of you taking a day off from work to go get medical treatment is pretty slim. You know, so how to provide more equity, that's a larger system issue that I think we truly need to keep looking at. But some of the things that we can do is look at what public health agencies are already out there, what nonprofits are already working. There are several nonprofits that are trying to help those that are economically less advantaged. You know, can we get an increased volunteers to make masks? As Monica mentioned, you have to wear masks in Beijing. Well, here in New Jersey, we now have to wear masks everywhere also. You know, so not everybody can afford a mask. We certainly can't find them in the stores because they're sold out everywhere. But are there ways to kind of build up a community base of a mask making circle, let's say, at a church that maybe donates them to some area? So these are some larger issues that I'm not quite sure we have the answers for right to this moment, but we certainly need to look at and to keep building and to keep seeing how can we make this stuff happen, and how can we work with agencies and companies. You know, how can we work with Verizon, for example, to make sure that everybody has access to high-speed Wi-Fi. Because with all the kids doing school, with everybody doing school at home, those that don't have access to the internet can't do their schoolwork. So how do we make sure that happens? And I do know that Verizon, T-Mobile, and a few others in the area, a few other providers in our area are giving free internet access to families. But how do we make sure they know that that's available, and how do we make sure that they can access it? So those are, again, just some larger system issues, but that I think we are aware of and are trying to address. Yeah, a lot of major questions about public services being asked during this pandemic. Julia, the topic for today's session was actually your idea, Julia. Could you just say a word about how you're coping in these stressful times? And do you have any questions of Pat?
I'm doing well at the moment. So is my family. I think it's been really like really weird to like adapt to this whole situation, because as I've said, I'm a boarder at Westover, so it's been really weird because now I'm like stuck at home instead of being at school, which has been like a whole new thing for me. I miss my friends a lot. I think that's like a big thing. For Pat, I actually do have a question. One of my questions is, what actions as students can we take to help lessen the stress when it comes to the virus and our own academics? Because I think a lot of students, even though it is a virtual, even though we're learning virtually, I think there is a form of like a higher stress placed on academics, even though we're doing it from home.
Mm-hmm. So again, great question, and very real, of that you have the stress now of a significant change of being home. And for those that are coming from boarding schools, this is a big change. I mean, you're going from living, I'm guessing like in a dorm type of area, into living back home with your parents or family or whomever it happens to be. Huge change. And now all of a sudden you also have, oh my gosh, how do I continue to be a sophomore, junior, senior in high school, or freshman, whatever year? And how do I keep my academics on track? So the first thing I would say is go back to those 4 C's. Let's look at what we can control. Can we control the assignments that teachers give? Not necessarily, unless we're able to advocate with them like, hey, this one's just a bit too much, or depending on the relationship you have with the teachers. Regarding home, what can you control there? If you miss your friends. So as I believe you previously mentioned, when you previously came home from school, one of the things you enjoyed was connecting with your friends in the town, in the neighborhood, in the area. Well, is there a way to still do that, albeit remotely? Probably using FaceTime or Zoom or Google Hangouts or any plethora of other social media type of connections. The research does bear out that face-to-face contact is vitally important. So if there's a way to connect with your friends, again, using Zoom or Google Hangouts or FaceTime or Skype, so you can actually see them, you can actually be eye to eye, because it's very different seeing somebody than it is talking to them on the phone or chatting with them or Instagram messaging them or any other number of things. So kind of looking at what is being the most stressful and what can you control. Looking again at the last C, which was connection. So how can you have connections? With school, are there ways to stay connected with some students that you felt particularly connected to? Other students in your class that maybe you guys can talk and, really commiserate about whatever the challenge happens to be. Maybe somebody has an idea of how to overcome whatever that challenge is. Regarding, again, schoolwork and actually life in general, one of the best things we can do for ourselves, actually the top 3 or 4 best things we can do for ourselves are get enough sleep. So try to sleep, 8 to 9 hours a night. Eat healthy as much as possible. And again, just be connected with others, but also to have some type of structure, some type of schedule. So for a lot of the parents that I work with, when we're talking about working with their teenagers or their younger kids, a lot is about structure. How can I build predictability into this unpredictable world? So how do I make sure I wake up around the same time every day? How do I make sure I'm scheduling around the same amount of time for school that I should be. And again, every day can have some fluctuation. I mean, that's one of the nice things about this is not, you don't have to sit in class now every day for 6 hours, 8 hours. But still, how do you have some type of structure? But then also, how do you build in time to make sure you have fun? A lot of the teenagers that I work with who tend to be high achievers, they're like, well, I want to get all of, I need to get straight A's, and I need to have my college applications done, and I need to make sure I get the perfect ACT scores and the perfect SAT scores. Well, those are great goals, and something certainly to strive for. But how do we have some type of balance? How do we have some type of building in time for fun and relaxation? I happen to be an athlete. I do triathlons. I actually do I do Ironman races. So I swim really far, bike really far, and run really far. And a lot of the athletic research that I've read bears out into mental health, which is stress plus rest equals growth. So we need to stress ourselves. So as an athlete, you train, you lift weights, you run, you do whatever it happens to be. As a student, you go to school, you go to class, you write your papers, you do your projects, again, whatever those assignments happen to be. But then you need to build in time for rest. As an athlete, our muscles, it's during rest that we regrow. It's during sleep that our brain regenerates itself. It's during sleep that our brain puts together all the information we got during the day. It's during sleep that our brain will says, well, we don't need that little bit over there, but we do need this. And it's only with that, it's only with stress and rest will we actually get better. So with the students I work with, a lot of it's kind of essentially me giving them permission to fool around, to have some shenanigans. What can you do for fun today? That's a question I ask every single person I work with. What are you doing for fun today? I start every day with a dance party in my kitchen. It's me and my cats. My wife is still asleep and I don't have any kids. But my God, I put on some 80s hip hop and we have a good old time. But how can you build that into your day? But also, how can you build in some mindfulness and some meditation? But just make sure, find some times to have some fun and frivolity. Jump up and down, dance.
The students, you have carte blanche to go have a good time. There you go. I like that.
Exactly.
No, some discipline in your routine, and then balancing. As you said, stress and rest will give growth. That's good. Casey, you're also a student at Westover. You've written for News Decoder. What are your observations as you go through this period? How has it been for you? And do you have any questions for Pat?
I'm doing okay. I think, my family, most are considered essential workers, so nothing has really changed for them. So it's basically just me being home alone all day. So that's very different instead of seeing people all day, every day at school, because even though I wasn't a boarder, I was there usually until like 9 p.m., getting work done, having dinner, doing my afternoon activities. So it's very different. And I think it has both pros and cons. Like I was so busy at school, I never had time for rest. And now I have lots of free time and lots of time to rest. So it's pros and cons, because now that I have more free time, I have a lot more time to my thoughts. And I think I feel proud of myself because I've had some mental health setbacks in the past and I've struggled a lot in my past, but I feel like I've been doing really well during this quarantine period of actually keeping my thoughts in check and keeping myself mentally strong. And I have a counselor at school that's also been really helping me. She helped me acquire these skills. And also just I don't appreciate being home alone all the time, but I also appreciate the time that I've been given to work on myself instead of having to just worry about my classes and worry about all my connections with other people all the time. So I think that's a good thing.
Wow, that's wonderful to hear, Casey. Well done. We have a question from the floor here. Thank you. We actually have two. The first one comes from an educator in New York. who asked, I'm curious to hear from the students from the various schools on the panel about effective community building efforts that are happening at their schools. What distance engagement efforts have been effective at their schools? The question's about effective community building efforts that are happening at their schools. What distance engagement efforts have been effective at the school? So I'm not sure I understand the question, but it seems to relate to what is the school doing to keep you guys as a community? Casey, you want to carry on and address that one?
I mean, for my classes, we have at least one meeting for each class all together. So that keeps like the students together. Maybe like every other week we've started having like all school assemblies at night. So like the whole school will log on to Zoom and we'll have a time together.
Wow.
At school we had chapel every week on Thursdays. So they've made like a chapel every week. So they've had like around like 40-minute videos about someone speaking, some of the students sending in the video and speaking as well. So I think that's also keeping us in touch. And I know personally, I'm a day student, so we have a lounge. So basically my lounge, we FaceTime every day during lunch. And we just kind of connect, eat together, then go to class afterwards. So I appreciate the efforts that my school's been making.
Mm-hmm.
Yeah, well, virtual meetings are a poor substitute for physical meetings, but it's a heck of a lot better than what we had a few years ago when I was your age at school. Ava, you're sort of straddling two schools, school year abroad in Spain, but also the school you will be attending in the fall, Andover in Massachusetts. I mean, what are those two schools doing to address this question of community engagement?
Well, I can first speak to school year abroad. You know, just like Casey said, my school, we have Zoom meetings with our teachers, usually once a week or so. And we also have conversation club to maintain our Spanish, because that was a really big element of, you know, studying abroad in Spain. And of course, now being here, that's something I think a lot of students are struggling with, because we're losing Spanish, not speaking it every day. Mm-hmm. So I'd say, you know, conversation club is a really great way to maintain that community and also kind of be learning in a more relaxing environment. But to my school, Andover, which I'm going back to in the fall, this is usually our upper fall is a really spring is really crucial for leadership positions like school president or, you know, whatever, vice president. And so we've been having kind of virtual debates or virtual elections and stuff like that to work with that. And that's it's a great way to build your community, because you get to see your friends take on these leadership roles. And you're also kind of just connecting in a fun way. You know, we have our virtual assembly. We have chapel every Friday. So we have our little assembly, which is always fun. But yeah.
Ava, you had a great question relating to what it's like to be in the U.S. jargon, junior year abroad, so second to last year of high school, when you're gearing up to, many students gear up to apply to college, right? So it's a very, it's a very critical period in your high school years. And I think your question was, I don't want to put words in your mouth, but it related to strategies for following now during the pandemic to mitigate the anxiety during this process. Is that a fair reiteration of your question, Ava?
Yeah, absolutely. I think also speaking to what Pat was talking about earlier, kind of that control element of stress, you know, before coronavirus, SAT feels like something you can control. You know, I study X amount of hours and I will get X score, or like I don't know, study for my math exam and get X score. But now having that loss of control, especially with admissions, you know, you're expected to have this and now you can't. How would you, I don't know, mitigate that anxiety or strategies?
Pat?
That's again a great question. You know, how to mitigate the anxiety. Again, what I work a lot with when people are anxious, it's kind of like, again, just what can we control and what is this anxiety actually about? And let's look at what is reality. So the reality is, for juniors across the board in the United States, their junior year, their spring semester junior year is looking drastically different than anybody had planned. and all of the colleges and universities are going to understand that. I will not be shocked if somehow some college personal statement essays have something along the lines of how'd you cope with COVID. You know, so it's looking at what can you do right now. And yes, actually, you still can study for the SATs or ACTs if you have access to some of the online classes or whatnot. You know, are there ways to be involved in your community? Are there ways to volunteer? Are there ways to help kind of maybe rally your friends to, I don't know, to go grocery shopping for some seniors? You know, so looking at what is the need that is out there, and is it possible for you to be able to meet that need? But it's also to look at the fact that every single junior in the United States right now is in exactly the same position you are. So nobody, not one single person, is gaining ground on you. And also nobody's really losing ground. It's kind of like it's like a temporary pause. This is the reality that we're dealt, that junior year, you know, spring semester junior year for you is going to look very different than it would have had this happened last year. You know, and again, so it's just looking at what can you control? What is it that, you know, your ultimate goal is? You know, if you looking at maybe if your goal is to go to university, is there a particular university or two that you're looking at? Maybe going to their websites and looking and seeing what are they doing for COVID. Again, I work here in central New Jersey, and literally across the river is Rutgers University. And we are a top-tiered research university, but it's a state school. It's Rutgers. The official title is Rutgers University, the State University of New Jersey. And if somebody wanted to go to Rutgers, I would encourage them, let's look and see what Rutgers is doing. You know, they were very involved in COVID research. The School of Social Work is very involved in social justice stuff right now regarding COVID. If you wanted to go into public health, you know, you might want to look at the School of Public Health at Rutgers and see what they're doing, and kind of gear, you know, what you're working on towards maybe that. And essentially selling the product to the buyer, you know, looking at what the universities have, what they want, and figure out how to market yourself to them. And then giving yourself a break, recognizing that spring 2020, everybody's life is a little bit different, and the universities are going to have to understand that.
Yeah, and there's quite a bit that one can do virtually. Again, not in nearly as satisfying a way as physically that you can do during the pandemic. If you play field hockey, maybe not. But if you are in a glee club, well, I mean, how many videos are going around of people singing in different parts of the world over Zoom and putting together some very interesting things. So, you know, I think you're right that there's kind of a pause and a paralyzing here, but there are creative ways, and if students can think outside the box, they can distinguish themselves among the others who are exactly in the same situation. We had another question. We have another two actually. They look both to be from Latin America actually. The first one relates to anxiety levels. It's really for Pat. How do you think anxiety levels among high school students, young people in general then, compare now to before the pandemic? Are you noticing increased anxiety, different types of anxiety? Can it not be measured? What are you observing?
Again, that's a great question. What a lot of the literature is showing, most of the literature has been based on what adults are experiencing. There has not been a lot of research on what adolescents are experiencing at this point. But what it shows is that the anxiety levels are going up, especially if somebody is predisposed to anxiety or has multiple levels of needs during this pandemic. So for example, if they're sick or if a family member is sick, then their anxiety is going to grow potentially. The teenagers I'm treating, what I'm seeing is that initially when the physical distancing started, the anxiety was great. Everything was new. Oh my God, what am I going to do? School's online. What if I can't do this? What if I can't do that? But as time has gone on, they sought support from their parents, from myself, from friends. But as time has gone on, they've kind of learned this new normal. And I've seen the anxiety levels actually diminish. Now, again, it's very different if somebody has multiple needs. So if they're not just dealing with being home and having to go to school online, but also now dealing with a parent who is sick, or as Casey mentioned, she has parents that are both essential workers. And I was curious if, what her parents do, and if that's having any impact. Because people feel safer when they're just home. It's kind of like, all right, well, the disease is not going to come in here. It's kind of a mixed answer. For some folks, I'm seeing an increased anxiety. For others, I'm not. But this is going to be something that I think longer term research is going to be done on, and we're going to see, is anxiety going to increase or decrease? I know that most of our students are probably not old enough, or definitely not old enough to remember 9/11, to remember September 11th, 2001. But after 9/11, many researchers were terrified that New York City and those that were in New York on that day would be paralyzed with PTSD. But what we have found is that, yes, the PTSD rates went up, but they did not skyrocket as much as we thought, in part because everybody was going through it together. So with 9/11, we believe that PTSD rates did not skyrocket because there was some community connection and community understanding of what people went through. And also because people were agents in their own rescue. So they were able to actually do something to stay safe. So kind of applying that logic to what we have going on right now, I would have to say that we're probably going to see an increase of anxiety, but maybe not a skyrocket of it. And it's going to be because we are all together in this. We have a mutual understanding, but also because we all have some level of being able to do something to help keep us safe.
There's a question, thank you, Pat. Another question from Columbia, and it's actually for everybody here. It relates to a measure that the Colombian government apparently has implemented, which is to help people reduce the level of stress. They've allowed people to go outside, if they're alone, to exercise. And the question is whether people think that that's from a medical standpoint, is that a good step or not? I mean, we're not medical. I mean, you're a medical expert, Pat, but I mean, we're commenting on a government policy, I suppose. But I guess the sense is, do you think that is something that would be helpful in your context? Students, you have any views on that?
So I personally don't really recommend that, because I feel like exercising, you can also exercise indoor, like in your home, if you have enough space. Because I know a friend who she was in quarantine for 2 months already in China, and then one day she went out to get her package, but the package guy has coronavirus, so he spread to her. So it's a matter of chance. I think for now, you just want to eliminate, you just want to reduce the risk of getting coronavirus. But I don't know what it's like in Colombia, so I can't make this judgment. But
fair enough. Okay. Pat, thank you, Monica. You're a triathlete. Wow. How are you managing in these circumstances when you cannot train presumably as much as you normally would?
I've changed things up, but I can answer this question very simply by telling you what I did Saturday, which is I went for a bike ride. I went outside for a bike ride. Most of my training, I've moved to being indoors. I'm very lucky in that my wife and I, we own our own house. We have a backyard. So what I do when it's nice out, I actually go out into the backyard and I exercise out there. Beyond our backyard is a school, and that school is closed. So I have the entire school property that I can run around and do things on with nobody else. On my back porch, I set up my bike on a bike trainer and I ride out there many times. However, for my own mental health, I need to be outside. I need the sunshine. Sunshine actually gives us some vitamin D. Vitamin D can help stave off, or at least help mitigate depression. So if you're able to go outside, and if you're able to do it safely, and if it's not going to increase your anxiety to do so, I do recommend it. Now, I'm not going to go against a government dictate. Here in New Jersey, the governor closed all of the state parks, and I think all of the counties also closed all of their county parks, and many of the towns closed the town parks. I'm not advocating for anybody in New Jersey to go to a state park and risk getting arrested. But if they're able to go out in their own neighborhood, every day, I tend to go out for a walk in my neighborhood. Now, again, I have my mask with me, so if we happen to see somebody, we're able to put it on. If I'm going out for a run and there's somebody else coming down the street, I make sure I go to the other side of the street. I take some safety precautions as much as possible, but my overall training, I've greatly adjusted. I do not have a pool, so I can't swim. So can't adjust that, just can't do it. I do a lot of weight exercises down in my basement, and I run on a treadmill or I run outside. But I believe in obviously following the law. If the government says shut down, we shut down. But if we're allowed to be outside and you think it's safe and you're not going to be around anybody, then try it. Because there is some research that shows that nature can be healing.
Akila, you're in a state which has been fairly aggressively relaxing some of the strictures, which I think in and of itself may create some tension because some people don't think it's time and they don't want to go back to work. How have you managed the stresses and strains in your own life there?
Certainly. And I just want to echo Pat's sentiments in that, yes, it is very important if you can to try to get out and get some sunshine and get your body moving, because that's crucial to taking care of your mental health and practicing self-care, which is something I've been looking a lot into. To answer your question, Nelson, I mean, it's certainly frustrating when you're in a state that isn't abiding by the guidance that prioritizes public health. I can tell you things that I've been doing similar to Pat. I was exercising and working out before COVID pandemic, and that's been something I've really been prioritizing because it's part of my self-care routine. So, moving classes to Zoom. We have our Zoom kind of studio classes where we kind of get together for social time and we're working out and stuff. But certainly every day I'm taking daily walks. And again, I think that just depends on where you are as far as how you can mitigate the safety. So again, if you can wear a mask, if you can bring your hand sanitizer, definitely practicing 6 feet of distance or more, definitely more between people who are running and bicycling, because we know there's interactions with the air and airflow and how the virus transmit with that. And so, I think a lot of meditation I've been practicing. Again, there's not a lot I can control with the state government, with our federal government, but there are things that I can do. And the other thing I want to reiterate to the students is just practice compassion with yourself. This is a very tough time, and it is something that we're all dealing with, even people who are, much older than us. This is something that they have not seen either. And so when you're dealing with these pressures of, still wanting to do well in school and still wanting to maintain, your friendship circles, just, be aware that you are dealing with something that is very challenging, and you may not get it right, the next couple of weeks, but just trust in doing these things that are going to strengthen your mental health. So if it's getting exercise, if it's connecting with friends over Zoom, just taking care to be compassionate. It's very easy to put pressure on yourself and want things to look the way they did before. But I think if you can keep that in mind, that you're doing the best that you can in your given situation, and you're doing what you can control, having compassion for yourself while trying to move forward, that can take you a long way. And those are the things that I've been practicing here.
Super, thanks, Akila. We have another question from the floor. There seems to be a lot of pressure amongst students in the U.S. to be productive and to be able to point to things they've accomplished during this time. It resonates with many conversations I've had with friends and family working in the U.S. This is from somebody who lives overseas, outside the U.S. rather. They feel more stressed out working from home because they feel they have to show their productivity and keep the same work ethic. How do you think U.S. work culture might change as a result of COVID-19? Pat, what do you think? And then anybody else would like to...
Yeah, wow. Great point. How do I think U.S. work culture might change? I think what's going to change is that we're going to have a lot more options to work from home. I think that we're going to have, my personal line of work is doing therapy, so we'll have more doing like telehealth. There'll probably be some more flexibility in hours worked and how you work. I do know people are having the conversation that unfortunately when we work from home, we tend to work more. You know, everything, technology is both a blessing and a curse. Without technology, we would not be able to meet today. But also technology means that your boss can email you at any time. You know, technology means that some people feel like they're on call to their work 24/7. So I think a larger conversation is going to have to be had about how do we set limits, how do we set structure, how do we have boundaries, so that we can continue to function. I do think that this is kind of I think COVID is highlighting some of that. I also think regarding work culture in the United States, there's also be a larger conversation about should health insurance be tied to work, or our place of employment, because as people are getting laid off, they're losing their health insurance. So there's the U.S. is coming to a reckoning. How culture is going to change, I honestly can't tell you. I wish I could. I wish I had a crystal ball.
A lot of
But
public,
I see.
a lot of
What was
public
that?
policy, a lot of public policy questions are being asked right now. That's for sure, especially in a
Yeah,
place like the
no.
United States, but not only the U.S. actually. Yeah.
Yeah, and they're great questions. And quite honestly, I think the culture change is going to be coming from the students on the call and students elsewhere. The culture change is not going to be coming from my age group. The culture change is going to be coming from the teenagers, the 20s, the 30s, the 40 somethings, as they start to come up.
That gives me a chance to ask a question of the students on the panel, and that is, what have you seen during the pandemic that is positive and which you think should be carried on after the pandemic ends? Are there things that you've noticed? We mentioned technology, which is kind of a go-to topic in these circumstances. But are there other things that you've taken away, that you've learned, lessons that you've learned that you think could usefully be applied after the pandemic that you weren't expecting, shall we say? Julia?
Personally,
Yeah.
I think it gave me a shot to like take a step back and almost like reflect on what I've done throughout like my school career, and also give me the chance to actually work on new habits that I'd want to pursue, I guess you could say. So for instance, I guess I could say I'm a high achieving student, so I always want to put my best foot forward with everything. And I think this pandemic has kind of shown into light that like I can't, sometimes like my best foot will be like my best point will be here, and sometimes it'll be here. Like it's not always going to be the same, and I have to learn to accept that. And I think that's like a really important lesson that I've learned during this pandemic, is that I have to give myself the time to step back and take a breather and kind of just accept things the way that they are.
Wow, that's maturity. Well done, Julia. Casey, what about you? Any lessons you've learned that will be useful for you post-pandemic, or for that matter, for others?
I think personally, since I've been choosing to take this time to work on myself, I think it's shown me that I actually have the strength to do it. Like, I guess before I had always been so busy, and there was always like I have too much work for this, or I have to do this, I don't have time to focus on myself. But now I have this priority, and I have like this pride to myself now that like I'm worth taking that time. So I kind of feel like having this time to myself has given me the precedent of like when things happen, when we're allowed to go back into the community and allowed to have our lives get back in order, that I had that strength and I can do it again. Like I can take care of myself while also having regular activities and being busy, I guess.
Thank you. Monica, what about you? What have you learned during this pandemic that you'd like to remember when it's over?
Like, I agree with Casey, because I think like focusing on yourself is very important, and like also like time management. Like you need to like relax your body and like relax your brain, and don't have like too stress. Like you shouldn't be that stressful, especially in this period. So like for me, I'm like I had to go to class in like midnight because I'm in China. So it's like very tough for me and like for my sleeping schedule. So I need to like adjust my schedules. Like when do I do my homework? When do I give myself like some free time so I can like communicate with my friends? And like I think that is very important. And like for me in the past, I'm like those kind of person who's really bad at time management. So I think this is the time where I like take it and then try to like adjust the environment. Yeah. So I think it's very important.
Well, we're
to-
not doing you any favors, Monica, by keeping you up so late. My apologies. But and the last word goes, because we're pretty much out of time. Ava, how about you? Lessons you've learned that you want to apply in the future?
Sure. I mean, one lesson I really want to continue on with thinking about is how privileged I am, to be in a place where I can focus on my self-improvement instead of how am I going to pay this bill? How am I, going to pay my rent? Or, well, how my parents are, I'm 17, I'm not working. But, I think I want to take that knowledge of my privilege and carry that on into other aspects of my life. When I'm out of coronavirus, how can I empower others or lift up others who aren't in a situation where they don't have to be worrying about, like I don't have to worry about, will my parents get affected from coronavirus because they're staying home, they're working from home, and I want to keep that knowledge and that privilege to kind of help work towards making, I guess, my community more equitable in that sense.
Wow. We don't have one expert on our panel today. We've got 7 experts, well, 6 experts. I won't include myself among those, but thank you very much, everybody. Our time has run out. This has been absolutely fascinating for me. I'm particularly impressed by the resilience of the students who are going through an exceptionally difficult time. I can assure you that I'm an old timer, and I've seen 9/11 and the 1987 stock market crash and other things, the Vietnam War. And this is every bit as much a historical moment. So you're living history. You're learning a lot. You're being extremely resilient. Thank you for appearing today, Pat. Thank you very much for your expertise and sharing it with us. And Akila as well. Thank you for making yourself available and for your observations. And again, thank you all. And we'll cut it off there. And wish everyone